In this video, we will discuss D and E abortions, otherwise known as dilation and evacuation abortions. Please be advised that this video contains graphic content. This is a second trimester surgical abortion, usually done between 13 and 24 weeks. This type of abortion usually takes 2 to 3 days from start to finish. By this point, the child can feel pain. First, somewhere between 24 and 48 hours before the abortion procedure, the abortionist inserts something called laminaria into the cervix. Laminaria is a sterilized seaweed that absorbs water and swells, enlarging the cervix. This is necessary because the baby is so big at this point. When the abortionist deems that the mother's body is ready, he gives her anesthesia to block the pain. He then inserts a weighted speculum inside her vagina to open the cervix so that he has access to the uterus. He must use a weighted speculum because the baby is so large. If the opening of the cervix is not large enough for the baby to pass through, the abortionist will then use a dilator to further open the cervix. He then uses a suction tube to suck out the amniotic fluid. However, the baby is no longer small enough to fit through the suction tube, so the abortionist must use what is called a Sopher clamp. A Sopher clamp is a grasping instrument that looks something like tongs, but it has teeth to help grasp onto parts of the baby. The abortionist uses the clamp to grasp an arm, a leg, or other body parts. Then he removes them from the mother. The most difficult part to extract is the head. The abortionist must crush the skull with his instrument in order to remove the pieces. Once the baby's parts are removed, the abortionist uses a curette to scrape out the uterus. He does this to make sure he has gotten all of the baby's parts. The abortionist must then assemble the baby's parts on a tray to make sure nothing was left in the mother. D&E abortion is a gruesome practice. We must work to protect preborn children at every stage. Thanks for watching. Please like, subscribe, and turn on notifications.